society. As I said before, mental health is a continuum. We're all at different points of the mental health continuum over our lifetime. We go back and forth in terms of where we are on the continuum, depending on our life situations, physical conditions, and how we deal and cope with them. Now, talking about disruptions in our normal lives, I think this is the mother of all disruption. None of us have ever seen anything like this before. There is nobody that hasn't been affected. Now, in order to have a healthy mental state or well-being, we need healthy relationships. Thus, in this stage, we're always saying, reach out, keep in contact with people while we are, isolated. A healthy lifestyle is important. A positive attitude, knowing your strengths, contribute to your community, help somebody. It makes us feel better when we help someone. Nurture your spiritual life, whatever that means, whether it be religion, meditation, nature, or whatever inspirational approach you have. So that's very important. Now, speaking of mental wellness, there are social determinants of health. And Black Canadians face significant social and economic challenges that have negative implications for our mental health. In 2016, the Mental Health Strategy for Canada, the framework from the Mental Health Commission of Canada, it stated that the mental well-being is deeply impacted by social determinants of health, such as precarious housing, poverty, social exclusion, and racism. In particular, Black Canadians face significant social and economic challenges that have a negative effect on their mental health. These challenges include things like anti-Black racism, systemic socioeconomic and other disadvantages, higher levels of poverty and social exclusion, and more frequent interactions with law enforcement, the criminal justice system, child welfare system, and also there's a lack of access to culturally appropriate and culturally competent services. And there's a stigma related to seeking mental health care. The systemic discrimination and racism means that Black people live in circumstances that leave them more vulnerable to illnesses at the best of times, and now make them susceptible to the ravages of the pandemic. They're more likely to be among the people who still use public transit to get to work, who hold those insecure, low-paying jobs where they're at risk for the virus. They don't have the luxury of sheltering at home or cannot afford to buy healthy provisions for a week or two. They can't go out and stock up, they can't contribute to the run on toilet paper or whatever else people are, taking. So there's that extra component when it comes to our well-being. Now, the mental health continuum is a range having mental health and mental illness at the two extremes. And depending on our internal and external faculties, at any time, we can lie at one point or another on the spectrum. We can be, as this thing shows, we can be at that optimal level where we have the self-care, social support, to mild distress, and it goes on. But it's a continuum, and that's, worth noting. Physical illness is diagnosable, and so is mental illness. Mental health is an important component of our overall health. I can't say I'm healthy if I am not physically healthy and I'm mentally strong I can't say I'm healthy. I gotta be the whole body, the whole man, the holistic approach. So at any time, we can be at any stage, physically or mentally. It's important for us to keep track of our mental and our physical health. Just as we monitor our bodies for potential problems or pain, it's important that we keep tabs on our mental health and try to better recognize when we need attention. If you're struggling to feel happy, struggling to cope with everyday life, you find struggling to find meaning or feeling connected to others, my advice, seek help. See your doctor or a mental health professional. Another thing that individuals have to deal with, it's stigma. Stigma is defined as negative attitude held by others. It's a barrier to receiving treatment for mental health disorders. The perceived negative attributes, such as believing that individuals with mental health problems are weak, incompetent, and cannot take care of themselves, are common forms of stigma. Stigma can be your own negative beliefs about mental health. We all have our own stigmas, and sometimes it's not so much the external stigma that stops us, but it's that internal one that we have. Other barriers to seeking treatment include access to mental health care and a lack of perceived the need for treatment. When a lot of times when people are ill, they don't realize it. Stigma shows up when we call someone with a mental illness, you know, they're dangerous, they're crazy, they're incompetent, rather than saying they're unwell. Language is very important, and so we have to watch that. Individuals with mental health issues are discriminated against because they are denied jobs, they're denied housing, they're bullied, they experience violence. These are all the things that we have to watch out for. Now, a Black person experiencing a mental health challenge is more likely to hide it or to delay seeking help over the fear of being shunned by or labeled by their community and the people around them. How can we avoid stigmatizing people with mental illness? We have to see the person first and not labeling them by their mental illness. You can help challenge stigma by speaking up when you hear people around you making negative or wrong comments about mental health. Because mental health is something that's viewed in a very negative way in our community. There's a lot of stigma, maybe getting a little better, but it's there. And to the person that's experiencing stigma, this is what I want to say, dealing with it. Get the mental health treatment that you need. Don't let fear stop you. If someone labels you, that's okay. It's on them, not you. Don't believe the things that you hear. Sometimes, you know, if we hear the same thing over and over and over, we start to believe it and we start to own it and we start to internalize it. Don't believe it. Talk to, you know, someone about it. Mental illness is not a sign of weakness. If someone had diabetes, hypertension, cancer, whatever it may be, they'd be running off to get the help they need. Now, mental illness is no different. It can be diagnosed and it can be treated. Don't hide yourself away. People with mental illness want to isolate themselves from the world sometimes, but reach out to people you trust, family, friends, coaches, your religious leaders. You can get the support you need. Connect with other people. Join a group, online, in person, most likely online in these days. And you will get the feeling that, you know, I'm not alone. And sometimes that helps to know that you're not isolated and it's not just me. You are not your illness. Do not define yourself by your illness. Other people might do it, but you don't do it. Don't say I'm schizophrenic. Say I have schizophrenia or I'm dealing with it, because there's a lot of power in our language. And on my last point, it's not personal. Remember that other people's judgments are theirs, and they had it a long, long time before they met you. These judgments, they have it from childhood or wherever they got it from. So their views is not about you, it's about them. So if you find yourself in a state where you need help, reach out for it, because it's there. And I'm not sure, but I think like 10 minutes is over. Yeah. And do you personally have stigma?
Thank you,
we have to question ourselves. And what are they? Yes.
Leslie, there was so much power in the words that you shared in this introduction. And you know, what we're really trying to do is normalize this conversation around mental health and understand the unique challenges that we experience in our community related to stigma, but also related to many of the things that you mentioned in terms of the, you know, the systemic barriers that exist in our society, the structural barriers and much of the discrimination that we faced as well. Thank you so much for providing that overview. I can see in the comments an absolutely excellent way to get us going in this conversation. I'll introduce Mary Ndati, who is a mental health navigator from Somerset West Community Health Center, and is going to talk about some coping strategies.
Thank you, Suzanne, and thank you, Resrin, for the wonderful presentation on mental wellness. Thank you to all the presenters and also to the audience who are listening to us. It's a privilege and honor for me to speak tonight about an area that I'm most passionate about, sharing and encouraging others when facing difficult circumstances, in whichever phase of life one is, as we all learn together. I'm speaking on a topic, and I'm grateful to Leslie for pointing out on some of the coping strategies that we can use. This topic, I am aware that we cannot address it exhaustively in 5 minutes because of its complexity in nature and for the many nuances that are unique to every individual, especially to our ACB community. There's a lot more that we can speak in another setting, and when we would focus on specific topics related to the overall mental wellness. So we are living in an age when whatever we have always known to be normal has been deeply challenged by the COVID-19 pandemic. It's definitely unprecedented time in the world that has pushed us to adjust to our usual routines so as to manage the challenges. And before I start talking about the coping strategies, just simply defining what coping is. Coping can be defined as to face and deal with responsibilities, problems, or difficulties, especially successively in a calm or inadequate manner. While strategy can be defined as a plan of action or policy designed to achieve a major or overall aim. And in this case, we are thinking about coping strategies, coping strategies with COVID-19. So it is good to acknowledge that the ACB community in Canada, in the world, over the years have faced health and economic disparities throughout history, which is well researched and documented. With all this in mind, the impact caused by COVID-19 pandemic is real to our community. The coping, and this is why it calls for every individual to identify a coping strategy that can be meaningful to them and that can work for them. The coping strategies that I will share are not relatively new. They're actually not new. Most of them we've just had a few minutes ago. And sometimes you may have already used them, others may not have used them. And you may pick one or two, or maybe none, or maybe you have something else that you use. But the goal is for us to think about what is it that we can be able to what strategy can we be able to use to cope? So the first and foremost thing that we need to do is to acknowledge our feelings. More often than not, and especially in our communities, we tend to not quite say exactly how we are feeling, but it's okay to feel sad. It's okay to be angry. It's okay to have tightness of chest. It's okay not to be happy. And in our community, we don't always have the language to describe what mental illness is to us. And for that reason, we describe it in symptoms that we may be experiencing at one time or another. So it is good for us to take time and pay close attention on how we feel and notice when our stress levels are rising or when we start feeling overwhelmed. So it's good to do emotional regulation, deep breathing, meditation, being present in the moment. How am I feeling right now? Am I sad? Am I tired? And that way it can help you to be grounded. And once you're present, once you allow yourself to accept the feelings that you are having, then you're able to cope with the stress that you have at the moment. Or you can even remember, how did I cope with this kind of a situation when it happened in the past? So what strategies work for you? Is it walking? Is it self-care? Is it talking to a pastor, or maybe reading a book, or whatever it is that you do? So it's good to also take time for yourself. You can read a book, you can go for a walk, you can do something that is exciting to you, or you can even just do something that you like and that you can connect with. Some people may even decide to pick a flower that they can just use, smell it, and then it can bring them back to what they feel. Eating well is a good idea. Something here, of course, if you can. And again, having a good night's sleep. And I realize that it's very hard sometimes when we have so many challenges, especially for our communities. You have children, you have families there, or you have people that you're taking care of, extended families and all that, and you have so much to do. And sometimes it feels like, am I making a mistake to just relax and just have something for myself? So it's also good to connect with people that you trust, not necessarily people who are going to put you down, but people that you can confide in, people that you can share what is going on with you. The next thing that we need to do is we need to know that we cannot control everything. For example, we cannot control the pandemic. We cannot control the lockdown. We cannot, there's so many other things that we cannot control, but we have things that we can control. We can control about how we feel. We can control how we respond. We can respond how we treat ourselves and even treat other people. So we can choose to be in the present. We need to start also practicing positive self-talk. More often than not, we have had people when they were growing up, maybe they had things like, you cannot make it in life, or you are good for nothing, or you are a failure. You started a program that you never finished, but that does not define who you are or who I am. So just speaking about that's something positive that we aspire to be is a good way that can help us cope. With the challenges that we are facing. It's also good to ask for help, as Leslyn has mentioned a little bit earlier. You can ask your friend, you can ask people you trust, And you can also go for therapy if you can. You can at the later on, Roman will let us know about the resources which are available. And it's also good to protect yourself while you also support others. And this can be as easy as making a call to somebody and calling somebody, or even just checking on them. Maybe it's your neighbor, maybe it's a friend that you haven't heard from for some time, and just calling them and knowing that you can be there for them is a good idea, because we know that there are some people who are isolated and they need to have somebody whom they can talk to. And the next thing that we need to do that can also be a way to cope is to unplug from media. We are flooded with so many things, from social media, from TV, from all sorts of things. And of course, people have all kinds of theories about this pandemic. And it can be very overwhelming. There are so many forwards that probably you receive each day talking about the COVID-19. Not to forget the myths that are there. And so it's okay to stay informed. It's okay to read and to hear what others are saying about all these pandemic. But on the other hand, it's also good to be careful. Choose a time when you would be able to get new updates, be it maybe from a TV channel that you can rely on. And also, it's also important to seek information from trusted sources. I find that sometimes when we keep watching news from one channel to the other, it becomes very overwhelming. And sometimes we may not even always know what's going on. But once we know, we only need to know a little thing or few things on how do we navigate the future, how do we navigate what's going to happen, then that way we can be able to be present and we can be able to cope with the strategies that we are faced with. And on that note, I will invite Hodan, who is a public health nurse from Ottawa Public Health, to continue with a presentation on the coping strategies. Thank you.
Thank you, Mary, and thank you, Lesline. Those are some really great tips. I'll go on to another slide or so. So I know we're all dealing with the pandemic in our own way, and but while we're doing that, we're also at home. Many of us are home with our kids, with our teens, and are worried about how they're coping with the pandemic. Sometimes we think that, kids and teens are not carefully listening to the information or the news that you're watching, but oftentimes they're absorbing the information and stress of people around them. They may be hearing things from their friends and making their own interpretations. They may be asking you, why can't I go to school? Why are my soccer games canceled? Why can't I see my grandparents? Why can't we visit friends and extended family? And so a lot of parents ask, how can I tell if my child is in distress? What can I look for? So in the next slide, just some things for you to keep in mind. First and foremost, you know your child best. And so look for changes in behavior or emotions that are unusual for your child. You may have a child who is mild-mannered, very calm, and all of a sudden he or she is, having anger or bouts of anger. He or she may be just all of a sudden very intense and panicked. And those are some things to look for that may get you to think, okay, maybe I should start having a conversation about what else is going on. Look for regressive behavior, and that's when you see a behavior that your child outgrew reappear. A child maybe who used to suck their thumb, or who was wetting the bed, has outgrown that behavior. It's reappeared now, and that's a normal sign of stress and uncertainty. When children feel uncertain and stressed, these are things that can come out. Changes in appetite. So either a sharp increase, a child eating quite a bit more, or a child who's got a normal appetite and all of a sudden refuses to eat and doesn't want to eat. A change in sleep. If you have a teen who is taking multiple naps or sleeping throughout the day, and that's unusual for them, that would be something that would cue you to say, okay, what else is going on here? Changes may seem to interfere with your child or teen's thoughts and feelings or daily functioning. So your teen might not be doing the things that they usually enjoy. They're not interacting with you as much as they usually do, so it's out of the norm for them. Or in some cases, they may just tell you, they're not feeling well, they're sad, they're anxious, and that's great. But most of the time, for most children and youth, a lot of these stress are expressed physiologically. So they may have headaches, stomach ache, things like that. So they don't always have the words to say, I feel worried, or I feel sad, or I feel nervous. It might be, mommy, my tummy hurts, my head hurts, I don't want to go out, I don't want to do this. And those are some things to look for. Trouble focusing, especially for older kids and teens. They may struggle with educational tasks. They may procrastinate. Some may have trouble just concentrating or paying attention. You've asked them to do something. 20 minutes later, you'll ask, remember I asked you to do something, and they can't recall what you asked them to do. So sometimes these changes in behavior are a sign that your child or youth may need support. Sometimes it's just that they may need to be reassured that everything is okay, we're safe. And other times it might not even be an issue, but at least you were able to look for some of these signs, and you can start the conversation and start the dialogue and explore to see what else is going on. Maybe there's nothing going on right now, but if there was a time that your child was going through something, or your teen was going through something, you already have a dialogue that you've established. So let's look at maybe some of the tips to help your child cope. So these are some general tips that Richard, I'll get you to go to the next slide. So first and foremost, start with yourself. I know this is this seems simple, but use some of the techniques and strategies that both Leslie and Mary just went through. Look at your own level of stress. Look if you're overwhelmed. What's the saying? You can't pour from an empty cup. So start with yourself. Make sure you're feeling okay. Talk to a friend. Go for a walk. Take a pause before you talk to your child about what they might be feeling. Keep it simple and acknowledge their fears. There's a lot of information coming at us. You can help your child by breaking it down into more manageable parts. Maybe focus on things that are important to them. They want to know that they're safe. They want to know that you're keeping them safe, and talk to them about the steps that you're taking. Talk to them about why there are cancellations, and how that is contributing to keeping everyone safe, and what you and they are doing within your household to make sure that to reduce the spread of the virus. Listen and discuss questions that they may have. So oftentimes, this is your chance of, we want to help. We always want to help. So we jump to the conclusion and say, okay, this is the solution. This is what you can do. But maybe it's just a matter of listening to how they feel and saying, you know what, I see that you're worried about this. It's okay to feel angry. It's okay to feel worried. It's okay to miss grandma. So just giving words to what they're going through, some vocabulary. I think we moved a bit, sorry. So, keep information age appropriate. Limit exposure. So avoid listening to the news and watching coverage while they're in the same room as you. If you have an older child who's using social media, encourage them to be aware of their social media use and help them sort of decipher between what is a fact and what is a myth, and share sort of what are some of the reputable sites that you can go to get more information. Establish a flexible routine for your child. So having some sort of a schedule or a timetable that sort of provides the child with some consistency to say, when we wake up, we have breakfast, you brush your teeth, you make your bed, time for a walk, do a little bit of work, leisure. Some of that provides a bit of stability, especially when children are not in school and teens are not in school. Be patient and understanding. So you may notice that your child's behavior is unusual. It can cause stress. It can, be very frustrating. But just try to be understanding with your child, as they may just need to be reassured and calm down during this period. So we'll go to the next slide. So this is a great fact sheet from specifically for teens from School Mental Health Ontario. It talks about how self-care is an important part of wellness, and it helps teens take time and discover what helped them feel good and recharge. And this is something that you can share with your teen. So it goes through a few steps, the importance of connecting and spending time with friends and family, pausing, making sure to take time for yourself during the day. They may want to listen to music, taking deep breaths, meditating, writing in their journal, their gratitude journal, maybe. Recognizing their own thoughts and feelings, both positive and negative, and realizing when those negative emotions and feelings are affecting their actions, and focusing more on positive self-talk and the internal conversations and dialogue that they have with themselves, and making sure that that's positive. Reflect and take time to think about what's important to you, and practice gratitude on a regular basis. And then just repeating these steps so that there's a higher likelihood of them continuing to use some of these steps. And the fact sheet also talks about the importance of sleep, physical activity, doing things that you enjoy, talking to friends. So it's a good resource, and School Mental Health Ontario also has a few other fact sheets for children, things that you can do if you wanted to set up a home learning environment, a positive home learning environment, how you can do that, some tips for parents. So it's a really good resource to have. So this sort of just sums up the points that both Lesline and Mary have shared in terms of dealing with the stress of the pandemic. One of the most effective ways to relieve stress or cope is by using the supports available from your relationships with friends and family, because many people are experiencing the same challenges. And you can find people within your circle that can help you and that can, definitely relate. Second, tap into your own skills and strategies and things that worked for you in the past. Can you use some of those right now? It's also important that you maintain some level of normalcy by developing a schedule or a timetable for you and your family, which can provide children and families with routine and some consistency. Remember that it's essential for you to continue doing the things that kept you healthy, eating well, sleep, going for walks, while maintaining physical distancing. And for those of you who are connected to a particular faith, praying or meditating, that's also very helpful. And if you need to speak to someone about your mental health, please know that there are resources that are available, and reach out for help. So our next speaker is Roman Ballet. So Roman will go through some of the resources that are available in our community, including those that are ACB specific. So we'll go on to some of the slides for Roman.
Roman, you're on mute. Can we just unmute Roman?
Okay. Again? Okay. Can I say again? Hello?
Okay, all good.
Hear
We can
me?
hear you now.
Okay. Okay. Did you hear previously what I said?
No, we did not.
Okay. So First of all, I greatly, it's my great pleasure to be part of this presentation. And this is the first one which I was part of it, really. And thank you also for the previous presenters. So they touched most of it, which I was going to say. So when I'm presenting the resource, I'm mindful that you may ask me that, is it really tailored for me? Is it for me? Yes, I acknowledge as part of ACB community member, so many of you may have experienced it, what it has been said, the fear of being judged, racism, discrimination. And so because of that fear, we tend to avoid reaching out to the professionals, which is a general services which is available mostly. And also we go to where we are comfortable, whether we go to talk to the priest or a church member, or friends or community. Although there is a limitation of the resources because of one, very few available, which is private and expensive. In the community center, we don't have much of the services specifically for ACB. So bear with me because we have to know where we reach out. Again, this would be an opportunity also for us to share what's already working for all of us and what's not working. You know better, you are expert of that, what is working or is not working. But as it has been said, everything in the past, when we have a physical health, we go to the doctor. We see a doctor, we get medication. When we have mental health issue, we do the same. So these are the resources to reach out. And one is very specific. The next slide, please. Next slide. So the ACB resource, which is surprising and timing based. This presenter doing it on May 9, which is wonderful. There is a registration, please. People who have benefits, they can, use this program or virtual presentation. It touch, which is already been said, the anxiety, and if we have depression, being isolated and all other struggle cause feeling depressed. So, and we all are anxious in the same way like everyone else, or if we have existing anxiety or depression, I think that this is the timing, it is escalate because of the situation to reach out to this. And the next slide, please. Next slide. Okay, so I am Somerset West Community Health Center staff as well as Mary. What we have posted now is this phone number. You can access us only in the afternoon, 1 to 4 o'clock. So you can call this number and Mary and I would be available because this number is shared with other staff members. So other time if you call, you may not get through to us. So I think that the linking to us
Oh, I think somebody has put themselves on hold and we're hearing a beeping noise. Roman, if you can unmute yourself.
Yeah, I did.
Okay.
Okay. So Somerset West Community Health Center, Mary and I were working. This is the number to reach us. I will make sure you know that it's only 1 to 4 o'clock Monday to Friday. Because this number is shared by other staff member, you can't reach us. So please make sure you call 1 to 4 Monday to Friday. And because of the limitation of the resources, I think we would like to know if people who have benefits, the next slide please, the private practitioners, and luckily enough, Ms. Leslie McQueen is with us. She's wonderful, the therapist. So these are the therapists which is available in the city. I think you can access it if you have a benefits. I mean, these therapists are aware because of they are from SCB community. So without fear of being judged, fear of the stigma that somebody knows me and then they will identify as have mental illness. These are the people, they know us and they are part of us. Please reach out to them. The next slide, please. Next slide. Okay, this is, as Hodan mentioned, mostly for children in use. It's a chat, text, telephone. It's more of technologically easy for the youngest one. So there is Kids Helpline and Youth Service Bureau line is bilingual. And then crisis services bilingual, and suicidal intervention also bilingual. Again, Hodan explained that to see the sign, when you see a sign, I think it would be appropriate to reach out to this resources for your children and youth. Next slide, please. The additional support is also, there's a mobile crisis line 24 hours. This is for the youth 12 and 18. You may be aware of those crisis lines. Mental health crisis line, also it's the local number, this one, 16 and above. Distress center. Entail Ed, also 24 hours, which is more French in local Ottawa and as well as in Gatineau area. This is when we are in crisis situation. Please reach out to this. This is one way to be linked to other resources. So reach out when you are in crisis, reach out to get connected with other resources. Next slide, please. Next slide. The other resources would be during COVID. This is a web page. Public Health has been posting on a regular basis. You can look at that. The new program which I would mention is the Royal Ottawa. I had opened during this pandemic time. It's a quick access. If we had already existing mental health issue, or if it is triggered by the pandemic, it needs a provider, means medical provider referral. Once you are referred, it's virtual, it's online, you get 4 sessions out of that. And then the chances, once you reach out to that, and the next possibility would be you'll be linked to other resources. This is going on well, and it's easy. You could be at home, you could be wherever is a safe place to access this program. The other one, maybe you have heard, it's funded by Health Canada. It's Wellness Together Canada. It's online. You can check it out. It is free. They provide a lot of services. And I think this is the one we can use at this time of this pandemic. And again, please, my community people, don't hesitate. This is there. It's funded. It's available. Let us reach out and use it. The other one, which is CMHA, which is ongoing, and now during the pandemic, they have more resources. It is free again. It is on a phone or online. They they are doing so much help when people have, whether it's anxiety, depression, whatever the situation has been. There's for young one, there's for adult one. If you check that one, you will find a lot of information, and also they provide support material you can use anytime, and they coach you, and it's a help. And please look at that bounce back. The other one, of course, mental health about COVID. Again, CAMH has so many tons of information in regard to coping mechanism and so many resources. You will find so many resources again. Next slide, please. Next slide. Next slide. Okay, just go on there. Okay. Okay, so this is specifically, we have to stay home to be safe, but if home is unsafe, this is what we reach out. So the unsafe at home is organized by the last one, which is OTTAWA. They have different kind of resources. So during pandemic, especially, it's chat online. Please look at this site, and then text, it is private. You can delete it after you chat it. They provide a lot of information. It is just to be safe at the time when you need it to be, when you are unsafe, you need to be safe. Service they are providing. The other one is Virtual Women Support Group, which is launched. And if you look at the Facebook, and you'll find more, and it's a regular virtual support. They touch so many topics, which is great. Please access that. And it's ACB community. It's targeted for us. The other one you may know already, the Rape Crisis Center, crisis line for women who are experiencing violence, and sexual assault support center. They have direct 24 hours number. I just like to mention also IWSO, that's Immigrant Women's Service of Ottawa. They provide so many supports for especially immigrant. There is language services also. I think if you look at OTTAWA, you could find a list of services including all this I listed. So I think my last message to you guys is we hesitate to reach out because fear of judgment. I know I am heard it and I have experienced it. So we're not going to give up with that, because as Leslie said that if they judge us, it's their own say. It doesn't make any difference for us. So our mental is very important. When mental, one part is not healthy, the other part is not healthy. WHO's definition is to be healthy is physical, mental, spiritual, everything. So unless we have that, get help, we're not healthy. So please keep up. This information will be helpful, I hope so. I know I'm acknowledging a struggle, but we have to face it. Thank you very much. And the next one would be, I can mention Sari. She's collecting and compiling all the chat and question and answer, and I will pass it to her. Sorry?
Sorry, did you guys hear me? I just want to mute. I just wanted to say a quick thanks, and the committee as well, to Richard Sharp who is from 613-819 Black Hub. Thank you so much for supporting us with setting up this call so that we are able to successfully share information through this platform. So thank you very much, Richard. Richard may have to jump off this call at about 7:30 because he has another meeting later on, but just wanted to extend our thanks before you jump off, Richard. There was a few questions that did come through the chat, mental health in teenagers. So the question was, knowing that most teenagers don't like to talk, let alone talk about how they feel, as a parent, how would they get their teenagers to open up about mental health issues so that they can get them support? Does anybody want to take a stab at that one?
I can maybe share some tips. I mean, it's true that most teens are not very forthcoming in general, let alone talk about how they're feeling. But they're, you know your teen well, so there might be a particular time in the day where they feel a bit, maybe happier, or they're a little easier to approach. For some, it might be at the end of the day where things are winding down. For others, it might be a time where they're going to walk, or they're playing a game. And so first tip I would say is to identify when would be a good time that they would be receptive to you speak to them. And when you know that, then try to have a conversation. And I would stay away from asking questions, because a lot of teens feel that can be intrusive. So maybe just being there and listening and sort of saying, this is what I'm hearing on the news about the pandemic. This is what I'm hearing on social media. Do you hear something like that? Are you concerned about anything that you're hearing? Do you have any questions that we can explore together? Talking about how they feel, and that'd be a good chance for you to say, okay, well, that must be hard. I can see why that would cause you worry. How can I help you? So, those would be some of my tips. I don't have any teens. I will in about 6-7 years, but those are some things that could work.
That's a great answer. Thank you for that. I know we don't have a lot of time left. We're actually past our 7:30 mark. Let's try to do one more question. The question is, you mentioned anxiety. When do I know if my excessive worry regarding our current situation is normal or developing into anxiety?
So, I mean, I think some level of worry is normal. I mean, it's how we stay safe. For you to be worried about the pandemic causes you to look for information of how you can stay safe. So most of us worry, and that's our way of thinking about how to solve a problem, or how to identify solutions to a particular issue. And I think that that is healthy. However, when a worry becomes something that consumes you, makes you feel tired, exhausted, doesn't lead to you identifying solutions, where you are catastrophizing things that are happening, you're not able, and it interferes with your daily life, that would be a time where that it would be a concern that you would need to talk to someone and about how you feel. It doesn't always have to be a diagnosis, but it could just be that you would need to talk to someone to help you figure out some strategies to think about, okay, what is the problem, what is a hypothetical problem, and a lot of the ifs, and that's what causes that worry. So that might be some way to distinguish between being worried and being worried so much that you can't. I don't know if anyone else wants to add something to that.
All right, so let's do one last question just for the sake of it. This year's Ramadan is very different for me because I can't go to the mosque or be with my friends and family during this time. Ramadan is something many of us have looked forward to. What can you suggest for those of us who feel isolated at a time like this and can't spend with loved ones? Good question.
I can, I can relate. My family fasts, and it is a different. It has been a different experience for many of us. But for me, I'm trying to look at this as an experience to create new memories with people who live in my home. I'm finding that I'm focused more on the spiritual aspect. So I have a timetable of activities that I do with my kids. And some of that includes, time for prayer, where we can do a bit of teaching, where we can sort of get the kids to understand why we're doing this. But in terms of isolation, you can, physical distancing and isolation doesn't mean you have to practice social distancing. You can still have breaking of the fast over WhatsApp, over FaceTime. You can still connect with people you love. You can still provide support to others by reaching out. Charity and giving is a huge part of this month. So those are things that you can still do. But I understand it's challenging, but there are ways that you can still connect and stay in touch with people that you care about and care about you, and a chance for you to reach out to those who may not have any friends and close family.
That's great. Thank you, Hodan. So guys, I'm going to finish off this session with just some closing remarks. Thank you so much for everyone for joining us this evening. We hope you found the information very helpful and that what you heard today can help to start a conversation around mental health and wellness and provide you with some tangible ways to take care of yourself. Having said this, it's still really important for us to acknowledge that not every conversation about how you feel and how you're dealing with challenges can be easy. And so, yes, sometimes it can be overwhelming and it can trigger certain emotions. So just as a safety step, remember that there are professionals you can talk to about your mental health. Use the resources that there are from this presentation to reach out for more support. Just a quick reminder that this week, from the day before to May 10th, it is the Canadian Mental Health Association's Mental Health Week. This year's tagline is #GetReal, about how you really feel. So feel free to use it, promote it, share some insightful stories. Last but not least, our committee is working on planning future every 2 weeks. A link to this Zoom session will be shared on Somerset West Facebook in the next few days. Please follow them for updates and promotion on upcoming sessions. And until next time, have a great evening, everybody.
Hi, Rowan.
Roman and Mary, did you want to stay for just a few minutes?
Yeah, just to say hello.
Roman and Mary.
Yes.
Yeah.
Hodan, do you want to stay for just one quick minute?
Thank you.
Hi, Jane. Hi, Hodan. Hi, Sari.
Yes, hi, everyone. Nice to see you. Thank you.
Hi, Godwin.
Hi.
Godwin, we miss you.
Hello, Godwin.
Hey, Godwin.
Yeah. That was a great presentation.
Sarah says she misses you.
Okay.
You heard me, Hodan.
Okay.
Oh.
We miss you too.
Very nice to see you, Rowan. And Godwin, how have you been?
I'm good. How are you?
Good, good. Good,
I'm
good.
feeling
Oh.
very lonely here.
Oh, we are all working from home.
Absolutely. It's
Yes,
hard.
thank you. Yeah, I think they have to meet. So bye. Thank you, everyone.
Bye-bye.
We have to do something
Bye.
when this is
Bye.
all over. We'll do something when this is over.
Yes, yes. All right, thank you.
Okay, bye everybody.
Thank
Bye.
you. Okay, bye.
Bye.